Did you know bipolar disorder often starts at a young age, but it can take up to 10 years for the right diagnosis? Hi, I'm Dr. Aroldo Dargél, psychiatrist at the Ottawa Hospital and associate professor at the University of Ottawa. In this video, we will dive into how bipolar disorder presents differently in youth compared to adults, why early detection and interventions are so important, and practical steps for parents and caregivers to support teens struggling with their mental health. Bipolar disorder is a recurrent and disabling mental health condition that affects around 50 million people worldwide. It's marked by dramatic shifts in mood, energy, and activity levels. And these symptoms often start at a young age. In youth, bipolar disorder may look different than what we usually expect. Teens often experience sudden, unpredictable mood shifts, moving quickly from irritability or anger to sadness or anxiety, hyperactivity to disinterest, or even bursts of laughter followed by uncontrollable crying. These emotional swings, also called mood instability, don't always fit into neat categories like mania or depression, making it harder to catch early on. Bipolar disorder is often diagnosed late. Research shows it can take around 10 years for the correct diagnosis and treatment. This delay happens for a few reasons. Emotional and behavioral disturbance in youth can mimic other mental health conditions like depression, anxiety, or ADHD. Teens may not recognize or seek help for manic symptoms because they might feel good during these episodes. The stigma around mental illness can make families hesitant to seek help, fearing judgment or misunderstanding. By catching bipolar disorder early, we can reduce the severity and frequency of mood episodes, improve social and academic functioning, and prevent more serious outcomes like hospitalization or suicidal behaviors. Identifying bipolar disorder in youth can be tough because some symptoms might look like typical adolescent behavior. But there are key signs to watch for that go beyond typical moodiness. Look for frequent anger outbursts or extreme irritability. While mood swings are common in teens, sudden and chaotic mood changes that seem out of proportion to the situation or come out of nowhere could be a red flag. Research shows mood instability as a strong predictor of which adolescents might develop bipolar disorder, even without a family history. Next, notice how quickly their mood and energy shift. Bipolar disorder isn't just about feeling up or down. Teens may experience rapid changes in mood and energy that don't fit neatly into traditional categories. One day, they might be bursting with energy and ideas, and the next day might seem withdrawn or unusually sad. Sudden bursts of energy, like silliness or excessively friendliness, can be more common in youth at risk for bipolar disorder compared to young suffering from depression or anxiety. Also, consider how these mood changes are affecting their daily life. If mood swings are disrupting school performance, friendships, or family relationships, it could be a sign of something more than just typical adolescent behavior. Finally, family history matters. Bipolar disorder has a strong genetic component. If a young person has a close relative, like a parent or sibling, with a history of mood disorders, their risk might be higher. For example, children of parents with bipolar disorder are 10 times more likely to develop a bipolar spectrum disorder compared to those without a family history of mood disorders. Recognizing these signs is important. But what steps can you take if you suspect bipolar disorder in a young person? Early intervention doesn't always mean starting medication right away. Non-medication approaches are often the first step for young people whose brains and bodies are still developing. First, ongoing monitoring is crucial. Carefully observing youth at risk over time helps identify when symptoms worsen and allows for timely treatment. Psychoeducation is another important step. Helping young people and their families understand bipolar disorder equips them with the knowledge to make informed decisions and feel supported. Family involvement is key to building a strong support network. Emotional regulation is also a core part of early intervention. Techniques like cognitive behavioral therapy, or CBT, mindfulness, and distress tolerance can help youth manage mood instability, avoid harmful behaviors like self-harm or substance use, and stay aligned with their personal values. Medication may become necessary if symptoms are severe or disrupting their daily life. However, it's important to avoid starting mood stabilizers too early before a proper diagnosis is made, as this can lead to challenges in managing long-term treatment. The goal is to balance effective treatment without overwhelming the young person or their family. Bipolar disorder is challenging, but with the right support and treatment, young people can lead balanced, fulfilling lives. Early recognition and intervention make all the difference in helping them to thrive. Thank you for watching.